There's a difference between a vitamin running a little low and a vitamin running so low that it's actively damaging the body. With most nutrients, the body has buffers. It can compensate, it can borrow from one system to support another. With vitamin B12, those buffers run out, and when they do, the deficiency stops being a subtle background issue and starts producing what we call red flags. Symptoms that aren't whispers anymore. Symptoms that are the body's way of saying the situation has crossed from concerning to genuinely dangerous. Severe B12 deficiency isn't rare. It's just rarely identified as severe because the symptoms it produces are still routinely written off as something else. Aging, stress, anxiety, early dementia, depression that won't respond to medication. The neurological consequences of a severely deficient B12 state can include damage to the spinal cord, damage to the peripheral nerves, and in some cases, damage to the brain itself. Some of that damage reverses with treatment, some of it doesn't. The line between reversible and permanent is drawn by how quickly the deficiency is recognized and corrected. The standard test that most doctors order will often show levels that look acceptable even when the deficiency at the cellular level is severe enough to produce red flag symptoms. So patients with serious deficiency are routinely told they're fine, sent home with reassurance, and the underlying problem keeps progressing. There are 8 red flags that, in my emergency medicine experience, almost always indicate a severe deficiency. When you see 3 or more of these together, you're looking at a body that's already been struggling for a long time and one that needs intervention quickly. Hi, I'm Dr. Alex. I'm an emergency medicine doctor, and after nearly 10 years in the AA&E, I've seen what happens when preventable disease isn't prevented. I've admitted patients with severe B12 deficiency presenting as suspected stroke, as suspected dementia, as unexplained anemia, as falls of unknown cause. In a striking number of those cases, the deficiency had been progressing for years, dismissed at every previous opportunity until the red flags became impossible to ignore. By then, some of the damage was already locked in. So before we go any further, I want to make you a promise. I promise to keep creating the most helpful videos I possibly can, grounded in science and the latest research to help you live longer and to help you prevent the diseases I see in the emergency department every single day. And all I ask in return is that you give this fairly new channel a chance and hit the subscribe button. If you get to the end of this video and you didn't think it was worth your time, or you've not learned something new, then feel free to unsubscribe. No hard feelings. But if you give me your time and your attention, I'll give you everything I've learned from over a decade in medicine. So please help me out. Hit the subscribe button to help this channel reach more people like you. And let's continue with the video. Before we get to the 8 red flags, I want to spend a few minutes explaining what B12 actually does inside the body, because the red flags only make sense once you understand the mechanism. B12 is what we call a cofactor, which essentially means it's a helper molecule that 2 specific enzymes in your body cannot function without. Those 2 enzymes carry out tasks so fundamental that when B12 runs low, multiple systems begin failing at the same time. That's the part most people miss. Severe B12 deficiency isn't a single dramatic symptom. It's the simultaneous breakdown of several systems because one master ingredient has crossed below the threshold the body needs to operate. The first major job B12 does is help your bone marrow build red blood cells. Every single day, your body produces around 200 billion new red blood cells to replace the ones that have worn out. Each one of those cells needs to divide cleanly, which means its DNA has to copy itself accurately. B12, working in tandem with another vitamin called folate, is essential for that DNA synthesis step. Without enough B12, the cells can't divide properly. Instead, they grow too large, too few, and they don't carry oxygen efficiently. We call this megaloblastic anemia. The cells are still being produced, they're just oversized and underperforming. So your tissues, your brain, your muscles, your heart, all start operating on a reduced oxygen supply, and in severe deficiency, that oxygen drop becomes significant enough to cause its own set of red flags. The second job B12 does is even more critical, and it's the one that causes the most lasting damage in severe cases. B12 is essential for maintaining what we call the myelin sheath. Myelin is the fatty insulation that wraps around your nerve fibers, almost exactly the way plastic insulation wraps around the copper wire in your house. Without that insulation, electrical signals can't travel cleanly. They leak, they short circuit, they slow down. When B12 runs severely low, the myelin doesn't just thin, it breaks down. The nerves underneath become exposed, they misfire, and eventually, if the deficiency goes on long enough, they begin to die. This is why severe B12 deficiency causes the kind of neurological damage that can include subacute combined degeneration of the spinal cord, which is exactly as serious as the name suggests, and which can leave permanent walking problems even after treatment. Now here's where it gets really interesting and where most people get tripped up. Your body absorbs B12 through a remarkably complicated process that depends on several things working in sequence. First, you eat the B12, which is bound to animal protein in your food. Second, the acid in your stomach has to release the B12 from that protein. Third, a molecule called intrinsic factor, which is made by specialized cells in the stomach lining, has to bind to the B12 and escort it down to a very specific section of your small intestine called the terminal ileum. Fourth, the cells there have to recognize the intrinsic factor and B12 complex and pull it across into your bloodstream. If any one of those 4 steps fails, absorption breaks down. And in severe deficiency, often more than one of those steps has been failing for a long time. Stomach acid drops naturally with age. By the time many people are in their 60s and 70s, they're producing significantly less acid than they did at 30. That alone reduces B12 release from food. Add in the widespread use of acid-suppressing medications, the proton pump inhibitors, and the H2 blockers that millions of people take daily for reflux, and you have an entire population whose stomachs simply can't extract B12 from animal protein anymore. Then there's metformin, the most commonly prescribed diabetes medication in the world, which interferes with B12 absorption in the terminal ileum. Layer in conditions like celiac disease, Crohn's disease, gastric bypass surgery, pernicious anemia where the body actually attacks its own intrinsic factor, and a condition called atrophic gastritis where the stomach lining wears thin, and you start to see why severe B12 deficiency can develop even in people who appear to eat well. And there's one more piece of this puzzle that almost nobody talks about. The standard B12 blood test, called serum B12, measures total B12 floating in your bloodstream. The problem is that only about 20% of that B12 is actually active and available to your cells. The other 80% is bound to inactive carrier proteins and isn't doing anything useful. So you can have a normal serum B12 level on paper while your cells are functionally starved. The more sensitive tests are called active B12, which measures only the usable form, and methylmalonic acid, or MMA, which rises when B12 is functionally low at the cellular level. Most GPs don't run those tests routinely, so even severe deficiency can go undetected if the doctor is relying on the basic test alone. What we're now understanding is that B12 status exists on a spectrum, not as a simple yes or no. There's a grey zone, often called borderline or low normal, where the standard test looks acceptable, but the patient is symptomatic. Then there's the severe end of the spectrum, where the deficiency is profound enough that the body starts producing the red flag symptoms we're about to discuss. By the time those red flags appear, the deficiency has typically been present for years, slowly intensifying while the body's compensation mechanisms gradually exhausted themselves. Recognizing the red flags is the last clear opportunity to intervene before the damage starts becoming permanent. Just really quickly, if you're getting value from this video so far, please consider subscribing. It genuinely helps the channel reach more people who need this information. So let's get to the 8 red flags that reveal a severe B12 deficiency. The first red flag is persistent, often constant numbness or tingling in the hands and feet that no longer comes and goes. In mild deficiency, the pins and needles are intermittent. In severe deficiency, they become a near constant background sensation, sometimes accompanied by burning, sometimes by a complete loss of feeling in the fingertips or toes. This indicates that the myelin breakdown has progressed beyond intermittent disruption to sustained nerve damage. Patients often describe it as wearing invisible gloves, or as feet that don't quite belong to them anymore. When the numbness becomes constant, the window for full reversal is closing. The second red flag is significant balance problems and difficulty walking, particularly an unsteady gait that gets worse in the dark. The medical term for what's happening is sensory ataxia, a condition where the spinal cord can no longer reliably tell the brain where the legs are positioned. People with severe deficiency often start using walls and furniture for support without thinking about it, or they avoid stairs without realizing why. In the emergency department, I've assessed patients who came in after multiple falls of unknown cause, and the underlying problem turned out to be a severely deficient B12 level that had quietly damaged the spinal cord pathways for months or years. The third red flag is profound, persistent fatigue and weakness that prevents normal activities. This isn't being a bit tired after a busy week. This is needing to sit down halfway through making a cup of tea, needing to pause on the way to the bathroom, feeling like getting dressed in the morning is a major task. When B12 deficiency reaches the severe range, the megaloblastic anemia we talked about becomes profound enough that oxygen delivery to the muscles and brain is consistently inadequate. Patients describe it as moving through deep water or as having heavy weights tied to every limb. It's the body running on dramatically reduced fuel. The fourth red flag is significant cognitive changes, including marked confusion, memory loss, or personality changes that family members notice. This is the red flag that most often gets misdiagnosed as early dementia. In severe B12 deficiency, the brain's neurotransmitter production and white matter integrity are both compromised. Patients may struggle to find words they've used their whole lives. They may forget appointments they made the day before. They may become uncharacteristically irritable or withdrawn. I've seen families devastated by an Alzheimer's assumption that turned out to be a treatable vitamin deficiency, and I've seen others where the deficiency had gone on so long that even after treatment, some of the cognitive changes remained. The fifth red flag is severe, treatment-resistant depression or psychiatric symptoms, sometimes including paranoia, hallucinations, or what the older medical literature called megaloblastic madness. This is rare, but it's real. When B12 falls deeply enough, the chemistry of the brain destabilizes in ways that produce serious psychiatric symptoms. These patients are often hospitalized for psychiatric reasons, treated with antipsychotic medications, and only later, sometimes much later, does anyone think to test their B12. I'm not suggesting every case of psychiatric illness is B12, but when psychiatric symptoms appear suddenly in someone over 50 with no prior history, B12 absolutely belongs in the workup. The sixth red flag is visible changes to the skin and eyes, pronounced pallor that family members comment on, a yellowish tinge to the white of the eyes or to the skin itself. The pallor reflects the severity of the anemia. The yellow tinge reflects the rapid breakdown of those oversized red blood cells your bone marrow has been producing under stress. These visible changes often appear together in severe deficiency, and they're the kind of red flag that someone else usually notices before the patient does. If a friend or family member tells you that you're looking pale or yellow, take it seriously, don't dismiss it. The seventh red flag is a swollen, beefy red and painful tongue, often accompanied by mouth ulcers that don't heal in the usual time. The medical term is severe glossitis. In mild deficiency, the tongue may feel a bit sore. In severe deficiency, it can become dramatically inflamed, smooth and so painful that eating becomes difficult. Patients often lose weight as a consequence, which then gets attributed to other causes. The tongue is one of the most rapidly dividing tissues in the body, and when B12 falls severely, the tongue is one of the first places that can no longer maintain itself. And the eighth red flag is significant cardiovascular symptoms, a consistently fast resting heart rate, breathlessness on minimal exertion, episodes of lightheadedness or near fainting. In severe anemia, the heart is being asked to do far more work than it was designed for, simply to deliver enough oxygen to keep the brain conscious. Over time, this strain can lead to heart failure in vulnerable patients, particularly older adults with pre-existing cardiac conditions. When B12 deficiency reaches the severe range, what started as a vitamin problem becomes a cardiovascular problem, and the two have to be managed together. When you see those 8 red flags listed together, it becomes clear why severe B12 deficiency is described as a multi-system disease. It isn't one symptom, it's the simultaneous failure of nerves, blood, brain, mouth, and heart, all driven by the same underlying biochemical shortage. Recognizing the cluster rather than chasing individual symptoms in isolation is what gets people the right diagnosis in time. So what do you actually do about it? I'm not advocating for extreme approaches here. I'm not telling you to start injecting yourself with vitamins or to abandon your current medical care. What I'm going to walk you through are 5 concrete actions that, taken together, address the absorption pathway, restore the cellular supply, and protect your nervous system from progressing into the kind of damage that doesn't fully reverse. Each of these ties directly back to the mechanism we talked about earlier. The first action is to ask your doctor for the right test. The standard serum B12 test is the absolute minimum, and as I explained, it misses a remarkable proportion of functional deficiencies, including some severe ones. What you want to ask for is an active B12 test, sometimes called holotranscobalamin, and a methylmalonic acid test. Together, those two tell you whether the B12 in your blood is actually getting into your cells and being used properly. If your symptoms are pointing towards severe deficiency, your doctor may also want to check intrinsic factor antibodies to identify pernicious anemia, which is one of the most common causes of severe B12 deficiency in adults. If your GP isn't familiar with these tests or pushes back, you can request them privately through most major laboratories. Without the right test, you're treating a problem you haven't actually confirmed. The second action is to address the absorption pathway. If you're showing signs consistent with severe deficiency, oral supplements alone may not be enough, particularly if your absorption is significantly impaired. For most people with mild to moderate deficiency, oral B12 in the form of methylcobalamin or hydroxycobalamin at high doses, often around 1000 micrograms daily, can restore levels over time. Think of it like watering a garden through a leaky hose. You have to put more in at the top to get enough out at the bottom. For people with severe deficiency or with confirmed absorption disorders like pernicious anemia, B12 injections given by a clinician bypass the gut entirely. They restore levels reliably and quickly, which is essential when the deficiency is severe enough to be causing red flag symptoms. I'm not suggesting anyone stop taking their prescribed medication without talking to their doctor. Medication and lifestyle are not mutually exclusive. They work better together. The third action is to look honestly at your diet. B12 is found almost exclusively in animal products, meat, fish, eggs, and dairy. Plant foods don't contain meaningful amounts unless they've been deliberately fortified, like some breakfast cereals and plant milks. If you're eating a vegetarian or vegan diet, supplementation isn't optional. It's essential. It's essential. And even for people eating plenty of animal protein, the absorption problem we talked about means that diet alone often isn't enough past a certain age. Research published in the American Journal of Clinical Nutrition has shown that adults over 60 often have markedly reduced B12 status even when their dietary intake looks more than adequate. The food is going in, it's just not getting absorbed at the rate it used to. The fourth action is to support the broader B vitamin family because B12 doesn't operate in isolation. Folate, which is vitamin B9, works hand in hand with B12 in the DNA synthesis pathway. If folate is high but B12 is low, it can actually mask the anemia on a standard blood test while the neurological damage continues underneath. This is why supplementing folate without first checking B12 status can be genuinely dangerous in older adults because it can hide a severe B12 problem until the neurological signs become advanced. The two need to be assessed and corrected together. Eating leafy greens, legumes, and whole foods covers most people's folate needs naturally. But if you're supplementing, do it knowingly and ideally under guidance from someone who understands the interaction. The fifth action is to protect your nerve health more broadly while you correct the deficiency. Regular movement increases blood flow to peripheral nerves and supports their repair. Adequate sleep is when the nervous system does most of its maintenance and consolidation work. Managing your blood sugar matters here too, because high glucose levels independently damage peripheral nerves through a separate mechanism, and if you stack severe B12 deficiency on top of poorly controlled blood sugar, the nerve damage accelerates dramatically. Whole foods, regular activity, and proper sleep aren't glamorous interventions, but they're the soil in which B12 correction actually works. Without that foundation, you're trying to repair wires while the rest of the electrical system is still being damaged in the background. Let me bring this back to the central point. Severe B12 deficiency is a multi-step problem, which means the solution is also a multi-step process. You can't just take a tablet and assume it's been handled. You have to confirm the deficiency with the right test, address the absorption pathway aggressively if needed, fix the dietary supply, support the cofactors that work alongside B12, and protect the broader nervous system while repair takes place. When all 5 of those happen together, even severe cases often see remarkable recovery. Numbness fades, energy returns, mood stabilizes, cognitive sharpness comes back. I've watched patients in my clinic go from being convinced they were developing dementia to being completely back to themselves within 3 to 6 months of proper treatment. That's not a small result, that's a life trajectory being rewritten. I want to share a few things I've seen on the front line, because the numbers and the mechanisms only mean so much without the human side. I had a patient in her late 60s brought in by her daughter because she'd become unsteady on her feet and was getting confused in the evenings. The family was bracing themselves for an Alzheimer's diagnosis. We ran a broader workup than usual. Her active B12 was severely low. Within 8 weeks of starting injections, her gait improved. Within 4 months, the evening confusion was gone. Her daughter cried in the corridor when we told her the test result. Not every case ends like that. Some patients arrive too late, and the spinal cord damage doesn't fully reverse. But many cases, even severe ones, if caught in time, do. I had a man in his 50s who'd been on metformin for nearly a decade for type 2 diabetes. He came in with palpitations, breathlessness, and a noticeably pale complexion. His ECG was unremarkable. His full blood count showed enlarged red cells and a hemoglobin that was significantly below normal. His B12 was at the very bottom of the reference range, technically normal, but his MMA was profoundly elevated. He had been functionally severely deficient for years, missed by every routine check, while the medication that was helping his diabetes was quietly depleting the vitamin that his nerves and his blood depended on. After 3 months of injections, the palpitations resolved, his colour returned, and his energy came back to a level he hadn't felt in over a decade. What these cases have in common is that they represent the gap between what the standard tests catch and what's actually happening at the cellular level. Research in the journal Blood has shown that as many as 1 in 6 older adults may have functional B12 deficiency that the routine serum test fails to identify, and a meaningful proportion of those are in the severe range. That's a remarkable number. It means in any given waiting room of patients over 60, several people are walking around with a deficiency severe enough to be quietly damaging their nervous system, while their official blood results say they're fine. And here's the bigger picture I want you to take away. The reason this matters isn't just about avoiding tingling fingers or fixing a low mood. It's about what it means to live well into your 70s and 80s with your independence intact. The single biggest determinant of independence in later life is whether your nervous system still works, whether you can walk steadily without falling, whether your brain can still hold the thread of a conversation, whether you can drive, cook, manage your own medications, recognize your grandchildren. All of that depends on nerves and brain cells that need a steady supply of the building blocks they were designed to run on. B12 is one of the most important of those building blocks. Letting it run to severe deficiency for years isn't a small thing. It's the difference between aging into your 80s with your faculties intact and aging into your 80s dependent on others for basic tasks. This isn't your fault. The system has been failing to test for it properly for decades. The medications that contribute to it are widely prescribed without warning patients about the connection. The food system has shifted in ways that make absorption harder for older adults. None of that is on you. But the knowledge of what to ask for, what to look for, and what to do about it is now yours. And once you have it, you can act on it. You can pass it to your parents. You can pass it to your partner. You can pass it to anyone in your life who's been told their fatigue or their numbness or their brain fog is just part of getting older. 8 red flags: constant numbness or tingling in the hands or feet, significant balance problems and difficulty walking, profound fatigue and weakness, marked cognitive changes or confusion, severe mood disturbance or psychiatric symptoms, pronounced pallor or yellowing of the skin and eyes, a swollen, painful tongue with mouth ulcers, significant breathlessness, palpitations or lightheadedness. If you recognize 3 or more of those in yourself or in someone you love, this is not the time to wait and see. Ask for the right test. Active B12 and methylmalonic acid. Don't accept normal serum B12 as the final answer if these red flags are present. The damage from severe deficiency is preventable, and a lot of it is still reversible, but only if the diagnosis happens before the body's repair window closes. If you found this useful, please subscribe to the channel to help me reach more people.